Hi, everybody, and welcome to another episode with the Anxious Resistance. Today, I'm going to be talking about a medication known as Memantine, otherwise known by its brand name as Namenda. Memantine, sold under the brand name Namenda, is classified as an anti-Alzheimer's drug. Memantine was first created in 1968 by the pharmaceutical company Eli Lilly. Many of you may have heard of Eli Lilly before. It was developed as an anti-diabetic medication but failed to lower blood sugar. Later, it was discovered that it had actions on the central nervous system and could be used to treat dementia. It was first marketed in 1968 in Germany as a treatment for dementia. Memantine has several notable actions in the central nervous system. First, it acts as an NMDA receptor antagonist. So this is the exact same mechanism of action that ketamine has. That's why it's theorized that this could be used as an effective treatment for depression and anxiety. Second, it acts as an antagonist or blocker of the 5-HT3 receptor. This is a serotonin receptor that when blocked, they have found relieves nausea. Third, it acts as an agonist of the D2 dopamine receptor. So this is actually similar to antipsychotic medications, will have that action on the D2 dopamine receptor. Though its affinity for the D2 receptor is small, this means that its action here may be negligible. For this video's purposes, we will focus on Memantine's NMDA blocking action. So Memantine has a similar action to ketamine like I mentioned before. Ketamine is a drug found to have significant implication in the treatments of depression. It has historically been used as an anesthetic drug. In recent years, it has been found to rapidly relieve symptoms of depression. This is done through doses much smaller than the ones used for anesthesia. The antidepressant effects of ketamine are also long-lasting and may last up to weeks from a single dose. Memantine has a similar mechanism of action. Ketamine and memantine both work as blockers of the NMDA receptor. Logic would dictate that if they both block the NMDA receptor, ketamine's antidepressant effect is attributed to this mechanism of action blocking the NMDA receptor. Logic would dictate that they both may relieve depression if they both have that same action. So there is some evidence out there for memantine's use for depression. One study reports on memantine's potential effectiveness for a multitude of psychiatric disorders. This article states, Memantine monotherapy, so that means using it on its own without other medications, was found to exert effectiveness in several neuropsychiatric conditions, including autism spectrum disorder, binge eating disorder, and attention deficit hyperactivity disorder. For post-traumatic stress disorder and generalized anxiety disorder, Memantine was found efficacious or effective in augmentation with other medications. Augmentation therapy would be you already have a medication that somewhat works, but then you add Memantine to it as an augmentation, and then it works even better. Memantine was used as both an augmentation to selective serotonin reuptake inhibitors and standalone therapy. Most published studies found it to improve OCD symptoms. For schizophrenia, Memantine has been reported to be consistently effective for negative symptoms only. The manic phase of bipolar disorder also appears to benefit from Memantine. The depressive phase of bipolar disorder and major depressive disorder did not respond significantly to Memantine. Catatonia as a symptom of various disorders improved in several case studies when Memantine was used in combination with other medications. You can find the link for that article below. You can also visit our website for a full article on this video, and you can find all the links and information there as well. Another study concludes the NMDA receptor antagonist Memantine may be an effective augmentation therapy in patients with treatment-resistant anxiety. So this may also work for anxiety as well as depression. A third study states Memantine as an adjunct treatment appears to have significant efficacy in improving negative symptoms in schizophrenia. The efficacy and safety of adjunctive Memantine for bipolar disorder or major depressive disorder needs to be further examined. Most studies kind of end this way. They say, hey, there needs to be more studies, because you never really prove anything in science. You just show evidence over and over that this works. It's kind of a statistical manipulation sort of thing. Okay, so let's talk about some side effects and basic info of Memantine. Memantine is pharmacologically classified as an NMDA receptor antagonist or blocker. It is available in and capsule dosages of 7 milligrams, 14 milligrams, 21 milligrams, and 28 milligrams. It is also available in tablets of 5 milligrams and 10 milligrams. It has a half-life of 60 to 80 hours. It has various side effects such as arthralgia, otherwise known as joint pain, weight gain or loss, incontinence, diarrhea, vomiting, nausea, anxiety, agitation, depression, dizziness, fatigue, among others. So here's the anxious resistance take on Memantine. Memantine shows a lot of potential. It has some major benefits over ketamine therapy, although it has a similar action. It is a tablet or capsule form and can be taken by mouth, unlike ketamine, which must be administered through an IV infusion. Memantine shows potential in its mechanism of action alone, although the studies listed before further prove that it may be effective treatment for anxiety and depression. Memantine has more evidence behind it than some other off-label treatments. Memantine has not gained popularity with psychiatrists yet. More anecdotal and first-hand experiences may go a long way toward increasing the popularity of its use. It is our opinion, my opinion, that Memantine could be used as a third-line treatment for those who have failed selective serotonin reuptake inhibitors and other antidepressant categories such as serotonin, norepinephrine reuptake inhibitors, and tricyclics, as well as maybe some combination therapies with atypical antipsychotics. Memantine may be something worth talking to your doctor about. They may be hesitant to prescribe, but it could go a long way if you show them the research on Memantine's use for depression as listed in this article. So overall, Memantine looks like it could be a great medication. It may be a potential option for you. Look at the evidence, look at the articles listed, talk to your doctor about it. Thank you so much for watching this video. If you made it this far, smash that like button, subscribe to our channel for more content just like this, and thank you so much for watching. You guys make this community great. See you next time.